Hey ladies, it's me again, and I am back again with some more Monia Mail. I just got finished filling out some more applications today and messing around with this meeting time and your moot and your mountain. So I just wanted to, because some of you ladies already said that I'm going to go ahead and do a video. So I have another email. I'm not going to give the name, but I just wanted to go on and read it to you because I wanted to be personal because, typing and everything that I'm dealing with, I just want to make sure I'm answering everybody's emails because I really hate when I don't get back to people, to you ladies' emails. I read it, but I just need more time to respond, and this is the fastest way. Okay, this was sent on November the 8th. Hi Mona, thanks for sharing your journey to motherhood. I spent all day watching your videos. Girl, I know you watching along. You know my videos can be long sometimes. It gives me some hope in the face of my recent anxiety of pregnancy as a result of my loss of my sweet baby boy at 19 weeks this July due to fibroid/IC. And if you don't know what IC stands for, it's an incompetent cervix. I recently don't trust my body anymore, and I feel like I never have a child with a TVC that requires bed rest and such. I'm scared of attack because of stillbirth. How did you handle your fears? Looking at your baby, I see how happy you are. Could you share if the losses of your other babies affected you? I'm sorry about your husband. I can share some personal experiences with mental ill father if you would like. I hope he does feel better soon. And she signed her name at the bottom. And I did respond back. And I did ask if she can share some information for us on mental illness because I have been really educating myself about that. Okay, first thing first. When you deal with a loss, all types of emotions come. Anxiety, fear, depression, postpartum, you name it. You're going to go into a whole whirlwind. I mean, even questioning yourself as a woman, thinking you're cursed. Other people are going to they're going to treat you a certain way, whether or not they care about your loss or don't care about your loss. They may mention it, they may not, they may ignore it. You're going to find yourself questioning, why did these things happen? Okay, and I'm going to be honest with you. When I first had my loss in 2012 with no heartbeat, it was so devastating because we told the universe that we were pregnant. And then when we lost baby Hans, it was devastating. So when we got pregnant again with Melody, it was just like, yes. And so we didn't say anything until we were 5 months pregnant at 20 weeks. And then we ended up losing her. So it was crazy. So I ended up saying, okay, then I found out I had an incompetent cervix because we didn't know why we lost Melody. And the new doctor basically told me the reason why we lost Melody is because of my incompetent cervix. So I knew then, he told me just to get a stitch. So I knew just to get a stitch. However, my cervix, if you look at my old videos, my cervix started opening up very early at, I think it was before 14 weeks. So they had to put an emergency transvaginal cerclage on. Let me tell you about the TVC, and I may be saying it wrong, so make sure you do your homework on it. A transvaginal cerclage, it has been known to save pregnancies and bring babies to viability or even close to viability. I have a couple of friends, a handful of friends that have actually went full term with a transvaginal cerclage. And for all of you who do not know what a transvaginal cerclage is, it's a cerclage that's placed at the bottom, at the top of your not the top of your cervix, but at the bottom where your cervix is to close it. But it's at the lowest part of your cervix. And what it does is it prevents it from opening up so it can keep baby in there. However, sometimes baby's weight or your cervix can actually open up. So it is a very, I want to say the success rate is between the 60s to the 70s as far as the successful rate of a transvaginal cerclage. Again, you can do your homework, look it up online. Now, the success rate with a transabdominal cerclage, which is placed higher, and it's only done abdominally. So it could be done as if it's kind of like in a way if they're doing like a C-section or laparoscopically. The success far as with a transabdominal cerclage, I believe, is between 97 to 99% successful rate. Majority of the women who have actually suffered a second trimester loss went full term with if it's placed properly. There are two doctors that I know that are very top notch and are very experts at it, and that is Dr. Haney and Dr. Davis. And there are other doctors as well that I've heard of, and there are new techniques, and there are new doctors that are coming out, and they're doing the procedures for women. I've actually heard that sooner or later they're going to stop doing the transvaginal cerclage and just starting to do the transabdominals, because they're coming out more with a very higher success rate. When you look at a baby that was born with a transvaginal cerclage and still had to go in the NICU, these NICU bills are $300,000, $500,000. So to prevent that for a $5,000 to $30,000, $40,000 procedure is much more likely to do a trans abdominal. But they say it's a little bit more invasive. However, so is C-sections. I mean, but it seems that C-sections nowadays are very high. So, you basically said that you don't feel that you will have a child with a TVC. That's not true. I have a friend, Anna. She just gave birth in September to her baby Joseph after losing her twins last year. I have a friend, matter of fact, Marilyn. She lost her son due to an IC, and she went full term. I think she baked almost 39 weeks. I mean, she went full term, had a healthy baby boy with a transvaginal cerclage. I have a sister. This is before I even knew what incompetent cervix was. She had to have a transvaginal cerclage on with her first son, but did not have to have any cerclage on with her second son, and she went full term with both of her babies. I currently have some friends right now that are that just went full term with the transvaginal cerclage. There are percentages, but you got to keep in mind that the success rate with a transvaginal cerclage is lower than the success rate with a TAC. And if you've ever suffered a loss, you definitely want to go with the highest success rate, or at least have your options. However, with a transabdominal cerclage, most insurances is really hard to get approved, because sometimes they want you to deal with a loss with a TBC before they approve a TAC. In some places, they don't require you to have even experienced the loss, because some women need these the transabdominal cerclage because they have little to no cervix left. I mean, I've heard crazy stories of women who really don't have a cervix, and they have this TAC that's holding that baby in and went full term. So bottom line, the TAC has a very high success rate. However, I don't want you to feel like you're never going to have a baby because of the TVC. Regardless if you have a TAC or a TVC, you're still going to feel that anxiety because of what you went through, that nightmare of losing that baby. And as a mother, you could not do anything. It was out of your control, out of your hands. So even with a TVC, or even without a TVC, if in fact you do, if you're scared about stillbirth, that's just with any pregnancy, because I've known women to go all the way up to 9 months, and when it was time for them to deliver the baby was born stillbirth. So it had nothing to do with the cervix. It had everything to do with what was going on in the body and what was going on with the baby. So the thing is that you just have to face your fear. You have to face the storm. This walk, when it comes to having babies, is not easy as we all think it is, because nobody talks about the other side of what women go through when you're dealing with the loss and the fears. I can truly honestly say, by all of my friends, from Zakia, from all of my girlfriends, I could put names all the way down. We were in fear with our second go rounds. We're going to full term. Every day, every week that passed was just closer to the goal. But everyone knew that once we got to the 19-20 week, 20-24, and trying to hit viability and even go further, because like I never dealt with a baby that was in the NICU, but I have a friend, Zakia, that dealt with her daughter being in the NICU, and she ended up losing after the NICU, and she thought that 24 weeks was viability and everything would be okay, but it was a nightmare for her, and she still lost her daughter. You're going to have to face the storm until you see and have your daughter and your son in your arms. And it does get better after the 24 weeks. Because all of a sudden, 24 comes, 25 comes, 26 comes, and the further you go, the more viability that baby meets. And then when it's time for that baby to be born, once the baby is in your arms, you're like, but I even heard that, and even with myself, you're always checking baby. You're always making sure baby's moving and breathing and checking their breath because of the loss that you dealt with. Because of when your baby was born, you didn't hear the cries. You had to wait for a baby to pass away. So the only thing that really helped me was being around like-minded women and looking at other women that were 2 months ahead of me and seeing that they went full term. And everybody's cheering them on. So if you've never gotten with a group, because there's many groups on Facebook called the Elope group. I have a group. We have a group called 40 Weeks to Go that's on Facebook. And one of you, I'll be sending you that link in a few. If you're definitely trying to get information, I would definitely join the ABBA Loopers Forum. They're a nonprofit, but when it comes to an accompanying cervix, these women, they can give you the 411, and there's always someone there to support you and root you on. So the thing that helped me was I really took my own health into my own hands, and I really educated myself about an accompanying cervix. And I just prayed and I talked to friends, and me and Anna started trying to conceive at the same time. So we got pregnant. She was 1 month behind me. Zakia was 2-3 months ahead of me. So, and then one of my friends, Marilyn, I think she was about 2-3 months ahead of me too. So it's like all of these women who understood what a loss was, I teamed up with them, and so we were just basically encouraging each other on, and it made everything a little bit smoother to know that I'm not going through this walk myself. I remember last year, when Zakia had lost her baby girl, I remember she was posting about, she was so upset and talking about ripping things up, and I could imagine both of us just tearing down the room and kicking everything, kicking windows out because of what we went through with losing our babies. And we were talking about it and how she was crying and how I was crying, and I would speak to Anna and Marilyn about just what we were going through and how upset we were. But it was like all of us went full term. We went full term, and of course there was prayer. There were we got up with women who understood. We read, and of course, thank God, every single step of the way. Had the P17 injections every week, so that kind of helped things out as well. But you're always going to be, I'm going to be honest with you, if I get pregnant again, yeah, I went full term, but I think I'm going to still live in fear because I have and I understand how it feels to lose a baby. Now, not all transvaginal cerclages requires bed rest. Majority of the people that I know went on bed rest actually put their own self on bed rest. Like Anna, I believe she wouldn't go anywhere. She put herself on a day, what is that thing called? A wheelchair. I'm like, girl, you don't need nowhere. She was like, let me tell you something. I mean, when you deal with a loss, you're going to try to do certain things to make sure that you carry the full term. And sometimes it may help, and sometimes it's just, a mind thing. But if it gives you, if it puts you at rest, if it eases you, then yeah, you got the hiccups. So yes, I do. And so, yeah, you got the hiccups. You get the hiccups. Tell those hiccups to leave you alone. Tell them to leave you alone. Tell them hiccups to get away from you. And so, so I would say that's the only thing that made me feel like, okay, because I'm pregnant for a reason. And I just thought like, okay, I could go. And I'm going to tell you something too. It's nothing that a woman can actually do that would help her Because some people say I focused on this. That's not true. I did all of that when I was pregnant with Harmony. I even took out her clothes, and I was focusing, and I ended up losing her because of an incompetent cervix. Nothing is 100% guaranteed, and nobody wants to hear that. But however, if you have something that's almost 100%, it's better than nothing. I've heard women who've had the tack and their water broke. I've heard women that had the tack and it was placed in the wrong way, TBCs, infections, and stuff like that. So I guess it just really depends. But the only thing that I can honestly tell you is that while you are pregnant, enjoy that baby in you in the now. Don't worry about the future. Just enjoy the now. And I wish you the best of luck. And I hope I was able to explain it. But how did I ease my pain? I was able to ease my fears. I was able to vlog about it every week, and I got a lot of encouragement from a lot of you ladies. And so that was my way of coping with it. Okay, so I'm hoping I answered your questions. Again, the group is called Abalupers. Bless you. So I will look them up online and also Facebook and the Elope group, and just, team up with some women who understand exactly what you're going through, because you know Mona do. Ta-ta for now.